Good morning. Welcome to Senior Moments. I'm Laura Smith, and I'm here with Curtis Woods. How you doing?
I'm doing all right. How's the morning treating you?
Fantastic. Thanks.
Awesome.
So we are here today. Our topic is issues of aging, making your own decisions, and we're talking about Medicare planning insurance. So,
I'd say... Am I?
yeah, go ahead. Sorry.
Anyway, so I'll say this. We're also part of the Senior Resource Alliance here in Santa Clarita. And the Senior Resource Alliance is just a group of professionals with one major focus, seniors here in Santa Clarita. There's many different services that we provide, but mainly it's just an opportunity for adult children of seniors to kind of have the conversations in different capacities about topics they may not know about.
Exactly. And as an alliance group of professionals, we are mostly concerned about the collective outreach programs that we have, which are all informational programs, and they're all free. And once you use one of our services, a professional service, let's say, then you might have your fees involved.
Correct.
But our main focus is to get the word out there and what we can do to help our seniors and their adult caregivers.
Right. And in short, we like to be the one-stop shop for any kind of question you have related to any topic around senior lifestyle here, be it living facilities, health planning, insurance, end-of-life planning, anything. Have the questions, contact us, and we'll be more than happy to help you.
Exactly. And at the end of the day today, we're going to give all that contact information out.
That's going to be awesome.
Okay, Curtis, so who do we have today?
So today we have Elena Perez, who's a healthcare consultant and independent insurance broker agent. She's joining us, and we have an awesome topic today. Welcome to our show, Elena.
Thank you very much.
So today our topic is going to be Medicare, but first, tell us about yourself, your involvement in Santa Clarita, and how you, as an independent licensed agent, are related to Medicare.
Yes, I'm an independent insurance broker agent. I'm licensed for the state of California, and I'm contracted with most of the Medicare plans in California. I do not work for Medicare. I'm independent. And basically, I help seniors and all the Medicare beneficiaries that need help in Santa Clarita. And I'm also a member of the Santa Clarita Senior Resource Alliance.
Right.
And I get involved with the community, and they call me with questions all the time. It doesn't necessarily mean that I go out and try to sell insurance. I try to help the seniors with all their Medicare questions anytime they need it.
Great. You know, Elena, this might seem like a silly question, but can you tell us what is Medicare?
Yes. Medicare is a federal health insurance program that covers millions of Americans. The National Medicare Program was created in 1965. It has given people peace of mind and security of knowing they'll have access to health coverage.
Got it.
Medicare is administered by the Centers for Medicare and Medicaid Services, also known as CMS, and provides health care coverage to people who are 65 and over, and people under 65 who have certain disabilities, including end-stage renal disease after diagnosis. And Medicare is made up of 4 parts, A, B, C, and D. Okay. And Part A is hospital insurance, and it provides coverage for inpatient hospital, skilled nursing, hospice, home care, home health care. And the services do not cover under Part A include custodial care and long-term care.
Okay.
And the way you get Part A is if you worked at least 10 years and you built up at least 10 years of work in the United States, you will not pay a premium for Part A.
Does that have to be consecutive 10 years or just 10 years throughout your whole life?
10 years throughout your whole life.
Okay.
Yes. Cool. And people with less than 10 years of Medicare covered employment can still get Part A, but they'll pay a premium. And once they're eligible, they can sign up for at the Social Security office, and then they get a red, white, and blue card too. Medicare Part B is medical insurance, and that covers doctor's visits, preventive services, inpatient and outpatient physician services, outpatient surgery, labs, radiology, durable medical equipment, dialysis, and other medical services and supplies not covered by Part A.
And can you get this at any hospital? Or any doctor, or do they have to be part of Medicare?
They have to be contracted. They have to be doctors that accept Medicare.
Got it.
Right. And if you qualify for Part A, you're eligible for Part B. And you'll keep your Part B benefits for as long as you continue to pay for them.
Good stuff.
And then we have C and D.
Yes, and there's something important to remember also. You must sign up for Part B once you're eligible, because if you don't, you may get a Part D late enrollment penalty.
Okay.
Okay, and there are exceptions to those penalties. People that get extra help program might not pay for that penalty, and and then you asked me about Part C.
Yes.
Okay. Part C is often referred as the Medicare Advantage, and it allows you to choose a private insurance company to provide your Medicare benefits. And Medicare Advantage plans must cover all the services that original Medicare covers. And in addition, many cover emergency, urgent care, vision, hearing, dental services, health and wellness programs like going to the gym, and Medicare Part D prescription drug coverage. And basically, the hospice care and certain care for clinical research studies are exceptions. Hospice is covered under original Medicare, not Medicare Advantage.
Got it. Now, I would say for myself, I'm a relatively lay person when it comes to Medicare. I'm not really familiar with it. And so far, it sounds like the application process is pretty complicated also, or not. How does a person apply for Medicare? How do they get involved into that service?
You apply for Medicare basically by going to the Social Security office, and you could, if you're turning 65, you could go 3 months prior to turning 65. You don't have to be retired, so you could still be getting, you could still be working, and you turn 65 and you want to get Medicare, so you go apply. Okay. And you could contact the Social Security Administration, and if you get automatic enrollment. If some people get automatic enrollments and get the card, some have to go and apply.
Got it.
Right.
So then what dictates that some people get the automatic, some people don't get the automatic, they have to apply?
If you are, enrollment is automatic if you're receiving Social Security already before you turn 65, if you're disabled.
Okay.
Mm-hmm.
Okay, and so you mentioned that you don't have to be 65, that if you're younger than 65, how is that? If you're younger than 65.
If you have a disability before you're 65 for at least 24 months, then you could get Medicare also at any age.
Okay, and when you say disability, does that mean just because a doctor said that you're disabled?
Permanent disability, yes.
And do you have to go through Social Security to have them acknowledge that?
Yes.
Or how do you do that? How do you go about that?
You go to Social Security after, or sometimes right after the 24 months, they know you're eligible, so you go apply.
Okay, and then you have to, what do you, because I think you've interviewed my niece, remember?
Yes.
We had, Curtis, I was talking to Elena about this, my niece, who is very disabled, and she's only 40 years old.
Wow.
And we got all of her medical together, and like you were telling us, trying to get her Social Security, and we bombed out. We went through a lot. We gave them probably, I don't know, a foot deep full of paperwork. And what do you say to somebody if you're trying to get disability and Social Security and they turn you down?
They have the rules, so all I could tell you is where to go. You could go to Social Security. They do have the rules of determination. If you're disabled, I know the regulation says after 24 months you could go and apply for this. I don't know if she was missing anything that determining how they determine how you get it or don't get it. They normally will let you know if you're missing something. Was that the case?
No, the case in this was that they just said no. If you want, they just basically said no. If you want to apply again or dispute this finding, to call them back.
Okay. Yeah. So basically, with my scope of what I could do as an insurance agent is they tell us that people qualify at 65 for the Medicare, or if they're disabled over 24 months, they could go to Social Security and apply.
Got it. So when I think about the health care that I have through my employer, and it sounds similar that all these healthcare plans, be it through Medicare or employee provided, that there are certain windows of opportunity to enroll. Well, when does a person enroll into Medicare?
So basically, if you're turning 65, you could go enroll 3 months prior, and the Medicare will be effective the month of your birthday that you turn 65.
The month of your birthday when you turn 65. Gotcha.
Right.
The first
And then-
day of that month. Yeah.
Right. So that's the initial enrollment period. And then there's other special enrollment periods. Let's say that you're still working. So you might want to, when you turn 65, enroll for Part A and maybe not Part B because you're still getting insurance through work. But then when you know you're going to stop working and you're going to lose that insurance through work, then you want to go apply for Part B and give them proof that you are working and that you have credible insurance through work so that you don't get charged for a penalty.
Got it. And then what is this big thing about open enrollment? What is that about?
Open enrollment is every year from October 15th through December 7th, where you get a chance to look over your plan or pick a different plan and enroll or disenroll from the plan that you're on.
Okay.
And the new plan, the benefits you could see what are coming out for next year.
Okay, so we're like 6 or 7 days into open enrollment right now.
Yes.
So I guess this would be the busy time for the Medicare system to accept applications, re-enrollments, and things like that, huh?
Correct. And also, if you have Medi-Cal, you have open enrollment all year round. And if you get the extra help program, you could change plans any time of the year. If you only have Medicare and you don't have any special events in your life that allow you to change the plan, then the annual open enrollment that we're on right now, this is the only time that you could change.
So there are certain events in life that allow a person to enroll or re-enroll or change benefits or something to that effect throughout the year?
Yes. If you move to a different county or area where your plan is not working, then you have a special election period to change your plan. Okay. The plans go by county and zip codes and area. So if you move, there's just different times. If you lose Medi-Cal, if you get Medi-Cal, there are different election periods that you can enroll in.
Okay. Got it. So then some other things about Medicare. Tell us a little bit more about what our Medicare coverage choices are. Are those the with the A, B, C, and D plans? And then there are also, I guess, different Medicare drug plans and things of that sort.
Yes. The coverage choices are two main ways to get your Medicare coverage. The original Medicare and the Medicare Advantage. And there's also, the supplement plan or the Medigap plan. The original Medicare, you got to have, it's Part A hospital and B is medical. And then you have to decide if you want a drug plan. If you you have to add a drug plan, and you need to do it in a timely manner so you don't get a penalty.
And the drug plans sound like they have to be tied to a doctor's prescription or some sort?
No, not with a Part D. It does not need to be tied up with any doctor. When you have original Medicare, you could go anywhere you want with no referrals.
Okay.
And then the drug plan is just for pharmacy for the drug part.
Okay.
And then if you decide to add a supplement coverage to that drug plan, then you enroll in the Medicare supplement insurance, or what is called a Medigap insurance.
Medigap, okay.
And that means you could go to any doctor in the country that takes Medicare, and Medicare will pay 80%, and the supplement plan will pick up, depending on the supplement plan that you apply for, it'll pick up most of the costs or more of the costs.
So does that have anything to do, I've heard this phrase before, that's called donut hole.
Okay, that's basically that's in the Part D. You have the donut hole is when you going back to Part D, because I want to talk more about Part D too. Is you have what is called the coverage gap, and most Medicare drug plans have a coverage gap called the donut hole.
Okay.
And what that means is that the gap begins after you and your drug plan together have spent a certain amount of money that year. And in 2016, once you enter the coverage gap, you will pay 45% of the plan's costs for covered brand name drugs and 58% of the plan's costs for covered generic drugs until you reach the end of the coverage gap. And not everyone will reach the gap because their drug costs won't be that high, if they won't be high enough to reach the gap. And these items all count toward what counts towards the coverage gap is and getting out of the coverage gap is your yearly deductible, co-insurance, and co-payments. Does this count? So these items all count towards your coverage gap, the donut gap. The discount you get on covered brand names in the coverage gap, and what you pay in the coverage gap.
Got it. Got it. And then with some of these supplements and with the gap, and are there different levels of eligibility on what would be covered, what you might need supplemental coverage for? Are there different levels of eligibility?
So basically, you could have original Medicare and have Part A, maybe have insurance through work. Okay. Or you have original Medicare and just decide to stay with the Part A and not add Part B. And then you could add the drug plan or not add it. And then normally if you have a supplement plan with the original Medicare, you need to get the drug plan too, or it's advisable that you get a drug plan as well, because the supplements don't cover the drug part.
Okay. And then I guess when you're talking about adding these different parts, how does a person make that educated decision on what to add, what not to add? Is there an additional fee to add more and more services on that?
Well, if you work 10 years, Part A, you don't pay for. And then the drug plans could have zero premium. They could have a premium, a deductible, depending on the plan that you choose.
Okay.
And the same with the supplement. There's different levels, so there's a premium for that too.
Okay.
And then the other way you could get Medicare is instead of going just original Medicare with a drug plan and a supplement, or just a drug plan and Medicare.
Okay.
Is you could get a Medicare Advantage HMO plan or PPO plan.
HMO plan. Okay.
Okay, great. Well, we're going to be coming back. You're listening to Senior Moments. It's that time, open enrollment. So we're talking about issues of aging, making your own decisions, Medicare planning, on insurance, on Santa Clarita's hometown station, KHTS AM 1220. We'll be right back with Elena.